Alright, hi everyone, welcome to today's live. Hey, I am aware that I'm a little bit late. I apologize for that. I had some technical issues to set up. Alright, so welcome again, alright, to another episode of the Google Autocomplete Showdown. Alright, so I'm Saudi, I'm a Thrive Coach from FuelFit. Each week we will type in some keywords regarding health and fitness, what is most search phrase on the autocomplete that Google gives us. Alright. This week we are going to talk about the best exercise to lower your blood sugar. Alright, okay? So if you are watching this live with us, please let me know in the comments. Alright, and then just let me know we are here and stay engaged. Alright, okay? So if any of you are here live or just watching replay, if you have an issue of high blood sugar. Alright, okay, so today the content is going to be a little bit more serious. I hope it's not going to be too dry. I'm going to try my best to make it informative and also I don't know whether entertaining is the right word, but so today's topic is going to be a little bit more wordy, so to speak, because when you have high blood sugar and you don't exercise, there could be some alright, okay, so obviously my voice is not clear. Okay, hang on, just let me adjust myself. Okay, let me see. Alright, is this better? Okay, I hope this is better in terms of voice. Okay, so hi Pallavi, hi Vanita, hi Bunny. Alright, okay, so I hope the voice is better now. Yeah, let me know if you can hear me well. Alright, okay. So as I mentioned, okay, so today's topic is going to be a little bit more wordy, so to speak. Alright, okay. So, oh, it's body. Okay. Hi, body. Oh, yes, you mentioned that you want to, looking forward to catching this, right? Okay, all right, fantastic. Okay, so I'm going to bring up the slides. All right, everybody can see this, right? Okay, so today we are going to talk about the best exercise to lower blood sugar. Okay, so this is kind of like a little bit of a trick statement, all right, you're going to find out in a while. Okay, but before I talk about the best exercise, let's talk a little bit about what exactly high blood sugar comes from. All right, okay, so you need to know, hang on, just let me put my slides. Okay, so you do need to know, okay, whatever I'm going to share with you today, right, is basically a lot of the information is from Exercise is Medicine. Okay, I myself, I am a qualified Exercise is Medicine fitness professional. All right, so basically I went through training. I learned how to work with people with certain medical conditions. So one of the conditions that's covered during the training is basically diabetes. All right, so diabetes is pretty common right now. All right, so that's why we want to make sure that when you exercise with this condition, you are extra careful. All right, okay, extra careful. Okay, so what is exactly diabetes? Okay, if any of you have diabetes already, let me know. All right, again, how do you know you have diabetes? I'm going to show you later your numbers. Okay, if you have already done your blood test or your fasting blood glucose test, right? You already know the numbers. Okay, so for those of you who are unfamiliar with this, basically it's a disease that it occurs when your body doesn't make or know how to use this hormone insulin properly. All right. Okay. So there's two kinds. Type 1 is basically you're kind of born with this. Type 2 is generally a lifestyle disease, so you actually kind of develop it along the way. So we'll talk about the risk factor in a while. Okay. So what happens is it actually causes a buildup of glucose in your blood. All right. And if you build this up over a long period of time, it's going to cause a lot of damage to you. All right. Okay. So it can really hurt you after a while. Okay. So right now in Singapore or wherever you are, in fact, I think globally, especially in the developed countries, there's basically a war on diabetes. All right. So what can be done is to actually diagnose pre-diabetes first. All right. So before it hits the level of diabetes, we talk about pre-diabetes first. Why? Because when you are diagnosed pre-diabetes, then you can actually really do something about it. All right. Okay. So some of the risk factors, if you are overweight, if you have family history of diabetes, all right, if you're a lady, if you did develop diabetes during pregnancy of your baby, etc., heavy, okay, or you have PCOS, okay. For those of you with conditions like high blood pressure or your good cholesterol level is too low and triglyceride, which is your fatty, for the lack of a better word, okay, fatty cells are too high, all right, okay, then all these are risk factors for diabetes alone. All right, okay. So, so are some of the numbers for you to look at. Usually, you do two tests. One could be the fasting glucose test, right? Okay, where you're fasted and you go and take your blood test, and then from that number, depending on what the number is, then the doctor may put you on another 2-hour plasma glucose test. All right. So anyway, this is just FYI. I'm not a medical doctor, so I'm not going to talk about how the test works. But essentially, these are some numbers that will show you whether you're in a normal range, or you're pre-diabetic range, or diabetic range. All right. Okay. Okay. So why today is going to be a little bit tricky, because it really depends on whether you are pre-diabetic or diabetic. If you are diabetic, exercise is definitely very helpful for you, but at the same time, you need to be super careful. All right, okay? So know that pre-diabetes and type 2 diabetes can be either delayed or prevented completely. All right, so especially if you're pre-diabetic, we want to change. You can adopt a change in your lifestyle to totally eradicate the risk completely. All right, so basically, you don't even get started with the medication. You're just going to, yeah, not be at risk of getting diabetes, type 2 diabetes. All right, okay? Okay, so a little bit of a science. How does exercise help to lower blood sugar? Okay, so when you exercise, your body will actually burn glucose or blood sugar for fuel. Okay, so which means the more you exercise, the less extra blood sugar is going to be circulating around your body, right? Okay, so this effect will be amplified over time, okay, and it will actually lead to a decrease in insulin resistance. All right, so over time, this will help you, because increased insulin resistance is actually what causes type 2 diabetes. All right, okay. In fact, it's shown in research that when you do any exercise, any form of physical activity, it can actually lower your blood sugar up to 24 hours. Okay, and then over prolonged periods of time, it will really help you to be a lot more sensitive to insulin. All right, which means your body is better at burning the blood sugar or getting rid of the blood sugar. All right, okay. Okay, so when we talk about for most of you, the kind of exercise we're going to aim for, right? This is actually something that is prescribed for most general population as well, but it is especially important for those of you who are in the pre-diabetic state already to follow this guideline. All right, okay. So over here we have a little bit of RPE chart. Okay, so what we're aiming for is basically 150 minutes of moderate exercise per week. So moderate, you will see that is between 4 to 6 level. Okay, so what it means is you can go on and on. You should feel like you can go on and on. Okay, but you do breathe a little bit heavier. Okay, but you can actually have like short sentences. You can actually hold a short conversation with a companion if you're doing it with a friend. All right, okay. Okay, so that is how long and how hard. Okay, very important is especially for those of you who are pre-diabetic, right? Okay, you want, or rather diagnosed with type 2 already, you want to exercise daily, all right? So you don't want to live more than 2 days where you are not exercising at all. So really, you can't afford to be sedentary. Okay, you want to make sure that you're moving at least every other day, all right? At least every other day. So this is pretty important thing to note, okay? So, and you want to combine both aerobic exercise and strength training. I'm going to explain why in a while, all right? Okay, so for those of you who are liking the information I'm sharing with you so far, please hit the like button, okay? And then do share it with your friends as well, okay? Okay, so for some of you who are brand new, those of you who are here, Nobody, Vanita, Bernie. Okay, you all are already quite what do I say? Quite seasonal, right? Now you guys are quite seasoned already. So you're not really beginner, but if those of you who are watching this later on and follow up, you're quite beginner, right? Okay, so you can actually start really slow. You can start as slow as just 10 minutes walk. Right, start at 10 minutes. So try to have at least 10 minutes for it to be effective, right? 10 minutes. Okay, and then 3 days a week. And then you can do some stretches on the other 2 days. and then you start slowly add 5 to 10 minutes and work up to maybe about 30 minutes a day. That would be pretty good. Then 30 minutes a day times 5 days will give you 150 minutes already. All right, okay? Okay, good, fantastic. All right, so there's a few of you watching here today, so say hi if you just join us. All right, okay? Okay, so the two exercises you want to add on. First one is aerobic exercise. Okay, so the thing, again, like I mentioned, if you are already diabetic, right, you want to aim more for your moderate intensity exercises. So you can choose brisk walking, you can choose swimming, cycling, whatever. Okay, 30 minutes for 5 days. Okay, so things like cycling and swimming is ideal for some of you because it doesn't put pressure on the joints. Okay, so for diabetic patients, sometimes their feet may have issues. So that's why we want to try to choose activities that has less pressure on the feet, all right, as well as the joints. Okay, so that's one of the key reasons. Okay, and then stress is known to increase your general blood sugar level as well. So you want to reduce stress. And at the same time, again, some diabetes patients may actually have higher risk of falling. So you want to include some exercises that help with balance as well. So Tai Chi and yoga will be good options to include. Okay, so just take note, as much as possible for Tai Chi and yoga, have them like an add-on thing rather than the key aerobic exercise. All right. In fact, for Tai Chi or yoga, even yoga, you can actually do it as often as you want. You can do it every day, or even just gentle stretches. All right. Okay, so you want to include that, but key thing is to get your 115 minutes moderate aerobic exercise in. All right. Okay, so that's really very important. Okay, and then your strength training. Okay, again, strength training essentially is to build your muscle mass. So if your muscle mass decreases and is affected, you will actually going to have a lot of much harder time to maintain your blood sugar level. All right, so at least twice a week, and try to do your non-consecutive days so that at least you got your muscle group has a chance to rest. Okay, so moderate intensity as well. Okay, and you can aim for about 5 to 10 exercises per session. Okay, and we're gonna start off with higher repetitions, lower weight first. All right, so it's about 10 to 15 repetitions per set. And then as you get stronger, as you get more seasoned, you can actually work towards 8 to 10 repetitions of heavier weight per set. All right, okay. So this is for your strength training. Okay, okay. So this is the more serious part right now. If you are already diagnosed with diabetes, or if you know anybody who is trying to start exercising and they are already diagnosed with diabetes, meaning they are already on medication. All right, okay. You do need to check in with your doctor because there might be a chance that you need to adjust your medication when you are going to embark on a new exercise program. All right, okay. Okay, so what to look out for to stay safe? Okay, so I have a question coming in. Is there any danger if one does rigorous cardio for diabetes or cardio patients? So you mean Bodhi, I think you're talking about heart diseases, right? Okay, I'll answer that as well. Okay, I'll answer that as well. Okay, there can be some danger. There can be some danger. This is exactly what I'm going to cover next. Because you do need to look out for, you need to know what to look out for to know that you are doing it properly. All right. So obviously, for some people, I would say if you're just starting out, just start slow. Really, really start slow. Okay. But if you want to do vigorous, it can be done. Okay. But you need to take extra caution. All right. Okay. So I'm going to talk about it in a bit. Okay. So oh, this is Pallavi now. Okay. Okay, so Pallavi, I'm confused because I think you all are sharing the account, right? The watch. Okay. So two things can happen. Okay, basically when you take medication for diabetes, right, you are actually lowering your blood sugar. You're trying to control it, right? Okay. So if you hop onto a exercise program, there is a chance that your blood sugar may actually go lower. All right, so you get into this hypoglycemia state. Okay, so these are some of the symptoms. So if you are say exercising and you are experiencing any of these symptoms, all right, then you need to stop straight away. All right, you need to stop straight away, and then you can quickly take a candy or a small piece of cracker or a small slice of bread or even a sweet drink. All right, so you really want to get a carbohydrate snack in as soon as possible. Okay, and then you can check your blood glucose level after 15 minutes. All right. So again, if you're already diabetic and your medication, okay, if any of these symptoms happen when you are exercising, you need to stop immediately. All right. And then this is what you can do. Take a quick carbohydrate snack, and then you check again, and if you feel okay and your blood sugar level is okay, you can continue. All right. But if not, just stop for the rest of the day. And the best thing for you to do next is definitely to check in with your doctor, review the program, and let them know, because there's a chance the doctor may need to adjust your medication dosage, so to speak, if you intend to exercise more frequently. All right. Okay. So do check in frequently. All right. Okay. With your doctor. Okay. Okay. Then of course the other thing may happen, which is hypoglycemia. All right. So your blood sugar actually shoot through the roof. Okay. Then these are some of the symptoms as well. I think one of the most obvious one is the fruity breath. Okay. You can literally smell the breath. It's a little bit like sweet, fruity kind of smell. All right. Okay. And then for these people, definitely you want to avoid vigorous exercise. Okay. This is also perhaps a potential warning sign for you to check in with the doctor and do a blood test to see whether you are indeed diabetic already. All right. Okay. So very important. Then of course you want to drink more water, just to kind of just drink more water. Okay. Okay, so I mentioned aerobic exercise, which is steady state. I also mentioned strength training. Okay, so some people may have a question about, can I do high intensity interval training? All right, so this is kind of related to the question you asked, Bobby. So because high intensity interval training is quite vigorous. All right, it's quite vigorous because it's literally you're going to push yourself as hard as you can for 30 seconds, and maybe you go slow for about 2 minutes, right? Okay, and then you just can't alternate. Okay, this form of exercise is really taxing on the body. Okay, so you don't want to do more than 2 or 3 times a week. Also because HIIT training generally will actually cause your blood sugar to spike up first. All right, spike up first during the workout, and then immediately when you finish, it actually goes down. All right, so it can potentially be it can potentially be dangerous for someone, especially if you're just starting out, you're not familiar, and don't really know how you're feeling. Then I would say, no, don't start with HIIT. All right, okay, start with your other regular exercise first, and then you can start exploring a little bit. All right, okay. So if you want to try HIIT, it is very important that you keep a exercise log. All right, so what does the exercise log look like? Okay, so exercise log, right? Okay, apologize, there's a lot of words, I hope you can see the words. All right, okay. You need to take down detailed notes on how your body is reacting to the exercise. Okay, and then from there you can review. So for example, if you manage to do 1 round, 2 rounds of HIIT, and then you start to feel dizzy, you need to note that down. All right, then perhaps that's not the right thing for you. Okay, on top of that, you need to take note of a few things. When was your last meal? All right, when was your last meal? You should just take it before you start exercise, or is it 2 hours ago, 3 hours ago? So you do need to log all these things down, because this would be very useful information for your doctor as well. All right, okay. On top of that, I would suggest, if you want to do HIIT sort of high intensity rigorous exercise, do work with a fitness professional that is knowledgeable in this area. All right, okay. But all else, well, it's not a doom and gloom, so to speak, because if you don't do HIIT, that's fine. You can still work with your steady state cardio, or aerobic exercise, and your strength training. Of course, HIIT can be attractive sometimes because it saves time, right? It takes a lot less time. However, you need to exercise caution, especially those of you who are already diabetic. All right, okay. Okay, so this is a very simple starter sample plan one. All right, it might be too easy for some of those of you who are watching this live. Okay, but if you have a loved one who is just recently diagnosed, or been diagnosed for a while, they just need to, this is something simple to start with. All right, so this is a very good example of how you can do it very simply. Okay, it's literally after each meal of the day, just go for a 15 minutes brisk walk. All right, okay. There are many research, okay, that shows that just 15 minutes walk after each meal will significantly improve your blood sugar level. All right, okay. So this is something very straightforward and simple that can be used by everyone. All right, regardless of your fitness level, regardless of whether beginner or not. Okay, even for healthy adults, like, okay, you can just take this. Okay, there's this Chinese saying, 饭后100步, which is 100 steps after each meal. All right, okay. Obviously, 100 steps probably wouldn't take 15 minutes, right? But yeah, I mean, the gist is basically after the meal, don't sit down, don't watch TV, get up, take a walk. All right, go have some bonding time with family. Just take a 15 minutes walk, and that will actually greatly improve your health in general. All right, okay, very simple. All right, okay, and then if you're up for something a little bit more exciting, okay, it could be, say, before you work, you go for a quick 15-minute stairs climb. All right, and then afterward, you just go for a quick brisk walk, and then on top of that, you're gonna add on some simple body weight strength exercises first, or simple things like squats, push-up, lunges, your row using the incline pull-up bar. All this just aiming for 3 sets of 10 to 15 repetitions. All right, okay, so these are really just very simple starter plans that, again, anybody can try to adopt. All right, this will be safe for everyone. All right, okay, so pretty much that's covering most of what I want to say. But again, as usual, I always end off with this slide. Okay, like it or not, whatever we do, exercise is only one part of the equation. Especially for controlling your blood sugar, you still need to combine with a sound nutrition plan. All right, okay. So for those of you who are watching and if you're interested to understand what a sound nutrition plan means when it comes to controlling your blood sugar, let me know in the comments below. All right, okay. So that pretty much covers what I want to cover in terms of content. Any of you have any questions for me? All right, okay. So let me just. Okay, so Alavi had this question just now. Is there any danger if one does rigorous cardio for diabetes? Yes, so I already covered that. There is a certain level of risk, but I would say that doesn't mean you can't do it. Okay, you want to do it under supervision. All right, okay, definitely communication with your doctor, and then work with a professional that is actually knowledgeable in this area. All right, okay, then I have more questions. Okay, Palapi as well. Okay, is it normal when heart rate touches 210 when exercising? Okay, so it depends how young you are and also for how long. All right, so are you asking this for yourself? Okay, if this is asking for yourself, then 210 is probably a little bit too high. All right, it's a little bit too high if it's going to be prolonged period. If it's kind of like a touch and go, that is okay. But you probably don't want to hit 210 for a prolonged period of time. Okay. Okay. So, all right. So, Palapi, we probably might need to have a conversation about this. When are you feeling that? Okay. You're still quite young, so I think it's still okay, but it's a little bit high. All right. Okay, it's a little bit high. Okay. So. Okay, just touch and go, I think it's okay. All right, okay, just touch and go is fine. So Vanita wants to know about the nutrition plan. Okay, so I will look at covering that in the next episode, but not today. All right, okay, but thank you for your feedback. Okay, in fact, Vanita, I understand that you want to learn about intermittent fasting, so I actually have that plan coming up next week. All right, okay, so next week we're actually going to talk about intermittent fasting. So some of you might be interested. Is intermittent fasting really effective or is it really for you? You will find out in the next episode. All right, okay. So for your father, okay, you're talking about he's diabetic, right? Okay, so yeah, so simply you need to just starting off simple. 15 minutes walk after a meal will be the great place to start. All right, then from there you can push it a little bit further. Okay, so one more question. Those with diabetes, do they eat before exercise? All right, okay, fantastic question, Vanita. Okay, let me just keep that question there. Okay, so remember I mentioned something about you need to. Okay, so depends on. Okay, so if you're already diabetic and then you're already diabetic medication, right? Okay, so one of the ways you can do is to actually measure your blood glucose level before you start the exercise. Okay, so remember the exercise log I mentioned about, right? Okay, so that can be helpful. So for example, if I will check my blood glucose level before I start. If it's a little bit low, then yes, you need to eat something. In fact, the something is ideally a simple, easy to digest carbohydrate snack. Okay, you wait for 15 minutes, then you check again. Then if it's good level, then you can start exercise. If it's still a bit low, then again you need to take another snack and then wait again. All right, so we call it the 15-15 rule. So because everybody is going to be different, again, different dosage of medication, so there's no one size fit all. Okay, but if you when in doubt, you definitely want to measure your blood sugar level before you actually start the exercise itself, the session. Okay, but if you are, you know, kind of just new to it, especially if you're just newly diagnosed and you're just new to this medication, then again, you can start slow. You can just really literally start with 15 minutes brisk walk first and see how you feel. And then remember I mentioned, if you start feeling any of those symptoms, nausea, dizziness, cold sweat, everything, a bit shaky, straight away stop and then have a quick snack. All right, okay? So that, I hope that answers your question. Okay, so all right, so Bodhi, okay, good question. You have a sweet tooth, find out how to avoid sweets. Can you still continue eating multivitamin and coffee and do something to stay away from blood sugar, or is it only exercise? Okay, so I don't want to talk too much into it, okay, because I'm really gonna cover food nutrition plan, okay, for controlling blood sugar, okay, in the next, I think two weeks time. All right, okay, but exercise will definitely help to manage it as well. So remember, two prongs. Okay, you want to have your exercise in, you want to have your nutrition plan, and you combine together. Okay, so it is a I think of it this way as more of a holistic thing. Additional sugar to your body, it's not just about your blood sugar level, it does create other havoc as well. Okay, so I think just like what we have mentioned, we have talked about before, you can have your sweet tooth. It's about managing your portion, managing the frequency of you having it. All right, okay, so a big part of it is really about portion control and kind of slowly adjust your taste buds. All right, okay. So it's our taste buds is quite interesting. Like in a sense, if you take a lot of sweet things, you actually get more and more craving per se. All right, okay. One of the thing about aerobic exercise, right? I think I mentioned this before. In the past few episodes is when you do more aerobic exercise, it is helpful for you in terms of controlling your appetite and craving. All right. So what I would suggest is if you find it very, very difficult to control any of the cravings, one of the strategy, if you're talking about exercise strategy, would be to really get your cardio going. All right. Okay. That will definitely help with the cravings. Okay. All right. Okay. So if there is no more questions, thank you everyone for tuning in today. I am so happy with the questions you're asking. I love it that you're asking questions because that keeps me engaged and I know that I'm adding value to you as well. All right. Okay. So today is supposed to be a Lunar New Year Eve. Okay. So for those of you who are celebrating, Happy Lunar New Year. For those of you watching here today, I know you're not celebrating, but do enjoy your holiday as well. All right. Okay. So I will talk to you all next week. We'll probably be talking about intermittent fasting, and then we're going to talk about lowering blood sugar in terms of nutrition as well soon. All right, okay. So if you found this video helpful, do share this with friends, hit the like button as well. Do subscribe to the YouTube channel. Or share this awesome group with your friends, invite them to join us, okay, so that we can all become healthier and stronger together. All right, okay, so have a good rest of the evening and I will see you next week. Okay, bye-bye.